Hello, and welcome to the HIV care and treatment modules of the Healthcare Service Delivery chapter of the MSM Implementation Toolkit, or MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual, and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men and HIV. This module introduces mental health, which is one among the 4 HIV care and treatment approaches presented in this module. It is listed with the other approaches here for your reference. Mental health is an extremely important issue among MSM. However, physical health programming is often given precedence over mental health programs in many contexts. WHO defines mental health as a state of well-being in which an individual realizes his abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his community. Depression, stress from being a sexual minority, and experiences with physical and emotional trauma may impact not only mental health but also sexual health. When working with men who have sex with men, mental health must be considered along with physical and sexual health. Mental health may be affected by numerous positive and negative factors. However, this tool focuses on experiences of particular relevance to men who have sex with men. Aspects of mental health this module presents are listed here. They are sexual identity development, depression and HIV sexual risk behaviors, minority stress and HIV sexual risk behaviors, and trauma and HIV sexual risk behaviors. The first aspect of mental health that is relevant to MSM is sexual identity development. Sexual identity is an important aspect of an individual's overall identity and includes the manner in which they define themselves and their characteristic pattern of emotional, romantic, or sexual attraction. The term sexual identity is commonly confused with gender identity. Gender identity is an individual's deeply felt internal experience of gender, which may or may not correspond with the sex assigned at birth. Sexual identity development commonly occurs during adolescence, but like all people, men who have sex with men may become aware of their attraction to people of the same sex before, during, or after adolescence. Some common ways MSM develops sexual identity are listed here. Because social norms almost universally privilege opposite-sex attraction, some MSM may acknowledge their same-sex attraction later than their heterosexual counterparts. Some men may suppress a conscious recognition of their same-sex attraction, or, while acknowledging it to themselves, may conceal it from others or actively deny it in family or social contexts. Some men who have sex with men openly adopt a gay identity, a process known in some cultures as coming out, and they may do so at varying ages. This is determined by factors including their own sexual identity development, as well as cultural and community norms, family support, and personal resilience. And some MSM, even while acknowledging their same-sex sexual behaviors, will not identify as gay, or may instead use a term specific to their particular culture. Healthcare providers should recognize the process of disclosing their same-sex attraction will vary significantly among MSM. When providing services to men who have sex with men, healthcare providers must refrain from assumptions about their sexual identity and take the time to get to know their clients, understand and accept how they choose to define themselves, and accept that they may not choose to disclose their sexual identity. Healthcare providers should also be aware that sexual identity is a fluid construct that may change and be redefined by the individual over time. By establishing a rapport with their clients, healthcare providers will be able to have discussions and periodically revisit health issues that may be pertinent to sexual identity. Depression is the second significant mental health issue MSM often face. Research suggests that increased sexual risk behaviors may be associated with depression among men who have sex with men. Healthcare providers should assess for depression among MSM in order to address both their mental and sexual health needs. In addition to obtaining a history from the patient, depression screening tools can assist in making the diagnosis of depression. An example of this is the Patient Health Questionnaire, also known as the PHQ-9, which can easily be found online. Based on the clinical interview and the findings from diagnostic tools, the healthcare provider working with the client can develop a treatment plan. Minority stress is a third factor that relates to MSM and mental health. For MSM, experiences resulting from their sexual minority status may be associated with mental and sexual health problems. Minority stress can be caused by internalized homophobia, experiences of discrimination, and expectations of rejection. It often compounds daily stresses, and stigmatized individuals must therefore develop mechanisms to adapt to it. While minority stress may result from acute experiences, it is more likely to be a chronic condition due to its relationship with established social and cultural norms that stigmatize and marginalize sexual minorities. Minority stress is a relatively new field of study, but it has been hypothesized that some MSM may respond to it by excessively using drugs or alcohol. This is associated with sexual risk behaviors, including condomless anal sex. Thus, it is critical for healthcare providers to assess for stress and its association with mental and sexual health. Assessing for minority stress can be done using several brief scales. Presented here is the revised internalized homophobia scale, also known as the IHPR, is a 5-item measure used to assess internalized sexual stigma. A short series of questions, statements can also be used to examine experiences with discrimination and expectations of rejection. While not a substitute for a clinical assessment, the IHPR and these questions to assess for experiences with discrimination and expectations of rejection can be used as tools to start a discussion with clients regarding minority stress. Trauma and sexual risk behavior is the last facet of mental health we will present in this module. Individuals who report having experienced trauma, whether through physical violence, sexual violence, or psychological victimization, should be assessed for post-traumatic stress disorder, commonly referred to as PTSD. This is true whether the trauma occurred recently or in the past. Research indicates that men who have sex with men experience childhood sexual abuse at higher rates than heterosexual men, and that sexual trauma is associated with significantly higher incidence of HIV and STIs. The Post-Traumatic Stress Diagnostic Scale, PTDS, is a brief but reliable self-report measure that has been used extensively in both clinical and research settings and in the emergency room setting. The scale assesses for severity and duration of symptoms and takes about 10 to 15 minutes to complete. This concludes the mental health module. Be sure to go through the other HIV care and treatment modules.